Welcome to Cracking Cancer, where we tackle the tough questions about cancer with real patients and world experts. Our mission is to empower the cancer community through education, bring transparency to the oncology system, and drive funding for critical cancer research. Whether you're facing a diagnosis, supporting a loved one, or simply here to learn, we're here to bring clarity, hope, and action to the fight against cancer. Hi, everyone. Welcome to Cracking Cancer. I am your host, Dr. Kyle Concannon. I'm a physician scientist at the University of Colorado, and I'm joined today by our co-host, JJ Singleton. JJ, maybe you could introduce yourself.
Yes, my name is JJ Singleton. I am a colorectal cancer patient for a little over 10 years now. I was diagnosed at 27 in September of 2015.
Great. Well, thanks so much for joining. And today's topic is going to be living with cancer as a chronic illness. And I can't think of anyone really better to talk about that than you. You know, you've come on the podcast quite a few times and you've been through the ringer, you've, been through the ropes, you've been doing this for a long time. So I think a lot of people have perceptions about what it means to be diagnosed with a cancer. And I bet you had a lot of those perceptions too. And the things played out a little differently. Um,
Yeah, definitely.
so yeah, I mean, maybe just kicking us off, could you speak a little more to when you were diagnosed, how that went down, your initial treatments, things like that?
Yeah, as I said, I was diagnosed September 4th of 2015, the day, like the Friday of Labor Day weekend. So I had to wait all of Labor Day weekend, got my colonoscopy, and then within a week I was in surgery. It was, confirmed that it was a stage 2 colorectal cancer. Went into treatment about a month, and actually this Friday will be 10 years to the day that I started my first round of chemo.
Jeez.
I went to round 175 this morning, so almost 10 years to the week. But yeah, it was a frontline chemo at the start of Folfox, which anybody who's in the CRC world knows what that is. It's almost everybody's had it. We did 12 rounds, and me and my oncologist, we thought we were good. We did a scan and there was nothing in the colon, a colonoscopy. But then about 6 weeks later, I had that same throbbing and the same symptoms started coming back. Went to the doctor, and then this time they did a whole chest, pelvic, like the whole scan. And it turned out the cancer had spread to my abdominal wall and lymph nodes from my chest to my pelvic region.
Jeez.
And that's when I got sent to Duke, a lot more tests. And then that's when I first heard, incurable cancer.
Mhm.
I had no idea that that was anything possible, or especially in like the colorectal cancer, because that over the 6 months I'd learned a little bit about it, but it was something new to me. And then ever since then, I did, multiple treatments that failed, a clinical trial that worked and saved my life. And I'm still here 10 years later, ongoing treatments.
Yeah, and an inspiration to, providers and patients alike, I'm sure. You're someone who's gone through it all. And uh, I think even on the provider standpoint, we need signals, we need people like you who have benefited from some of the research we do to give us hope. But I think a lot of times when people are first diagnosed, hope is not really the predominant emotion, and often appropriately so. So I'm curious, when you were first diagnosed, you were diagnosed at a localized stage. How did your perceptions about your disease change when you were first diagnosed to when you were later diagnosed with metastatic disease?
When I was first diagnosed, it was a clear, I'm a huge sports guy, so it was a clear game plan. It was surgery, recover, chemo to kill any, you know, cells that had got loose or something during the surgery, or just, is what they said, to just take care of anything else. And then our plan was I was going to be done. Then I, get scans for a few years and then put this cancer thing behind me. And then when it came back, there was no game plan, because they're like, well, this is your life now.
Yeah.
Right now, we have these treatments available. We're going to start you here. Hopefully it works and you can, stay on them as long as you can until they quit working. And I never even thought that was possible, or that was even options for chemo. And especially like my biggest thing when I started chemo, because everybody who's been on it knows how hard chemo is on the body, mentally, but you had that end date. I was like, okay, I have 12 treatments. I can get through anything for 12 times. But now I was like, well, there's no end date. So how am I going to know how to get through it?
Yeah, and how did you tolerate chemo when it first happened?
I mean, it was hard. Like everybody, the educational sessions that you sit in before you start treatments, they always try to tell you how the side effects are going to be, but then they always end to be like, well, we're not a cancer patient or we haven't been through it. This is just what we know medically. And I was like, okay, well, I respect, y'all are way smarter than me. But then when I went through it, I was like, they have no idea what this is. This is like, it went above and beyond anything I could imagine. So knowing that already, I was like, okay, now I'm really going to have to like figure out some way to just, not get through it, but just keep showing up every 2 weeks.
Well, and remind me, when you were diagnosed, patient advocacy groups were not as big a thing. So you couldn't like go to tons of other people who have been through it.
Yeah. I mean, I know there was, now that I'm in the patient advocacy world, I know they were there. I think it was just so much harder to find because social media was a lot different in 2015 than it is today. I don't think people were promoting as much like advocacy stuff on social media because it was still more of a, high school, college, early adult thing instead of like an educational thing like it can be now.
Yeah.
So I had no idea that they were even out there at that time.
Well, then you got your first therapy and it beat you up. You were on FOLFOX, which,
Mhm.
for those who don't know, we have a spectrum of chemotherapies. Some are more gentle and some are more tough, and FOLFOX is one of the more tough ones. And yeah, to your point, 12 weeks, I can handle that. But then they come back and they tell you it works until it doesn't.
Mhm.
So what was the mindset then where you're starting to get into this is not time limited, this is a chronic disease, but how chronic it's going to be, meaning like how long this is going to go for, is different from patient to patient. So what was that feeling like?
It was just a feeling of defeat because at that point in time, I was like, man, I know they were going to put me on a little different. It was full theory this time instead of full thoughts because obviously full thoughts didn't kill the cancer in my body because it started growing again. And they were like, well, this is very similar, but a little different, still very hard to deal with. And I was like, well, at 12 rounds, it made me very weak. So now if I go more and keep going, so my mindset was just like, okay, I'm going to go until I just, I can't anymore. But also in my head, this is, I think, the first time I didn't know I was thinking about quality of life. Looking back, I was. So I kind of had a goal of like, I'm going to get to this certain age. And if I'm still, not enjoying any of my life and just going treatment to treatment, if I hit that age, then I'm going to make my own decision if I want to keep going. And looking back at that time, I had no idea, like, how profound or how like self advocating that was. I was just like, that was the only thing I could think of in my head of like, okay, I have a goal and I have some sort of game plan.
Well, it's interesting because we talk about these advancements in the sciences where we can, for some instances, take cancers that used to be really untreatable or very poorly treatable. We didn't have a whole lot for them. And then we say, oh, we're turning it into a chronic disease. And that's really a mark of pride that we have in the scientific community. But sometimes with that comes these toxicities and these side effects. And it's like, is that chronic disease worth the challenges sometimes or worth the toxicities and side effects? And when you're
Yeah.
faced with these options of lifelong fulfiri, that's a real consideration over some of the other things we have.
Yeah, totally. And as again, like that is way more eloquently put than what was going on in my head at that time. But yeah, basically it boils down to the same thing of like, yes, if we can make this a chronic illness, which is what the hopes were when I started going through those treatments. So like, okay, if we can stop it from growing, get it localized, and then, you can live your life until that drug quits working, which, they're like, at some point it's going to in your body. That's just kind of how they thought my cancer was, through biomarker testings and just all these other tests. They're like, this is what's going to happen. We just hope it's going to be a long time. And I was like, okay, well, I can handle that, but I don't want to just lay in bed and deal with side effects every day of my life. If there's nothing worth going through the hell that is chemo, I got to even the scale somehow.
Well, did they give you a sense for how long it might work for?
At that time, they didn't. I mean, I know people that I talk to now that go through there, there's a lot better sense of like if it's going to work. Cause biomarker testing that's came so long from even in the decade or 9 years since then, in which I love seeing. But yeah, at that time they were just like, well, maybe we're going to give you a scan after 4 treatments. And if it's working, we're going to do it again and give you another scan after 4. But going back to me, the first 3 different treatments that they kind of made cocktails of, none of them were working after 4 scans or 4 rounds.
Jeez. So
I
when
went,
you got your first follow-up scan, there was progression already.
and I already knew it was going to be because at this point, where the cancer was growing in my abdomen and abdominal wall, I could feel the pain. Like this was a
Mm.
pain that I hadn't felt more than a throbbing. It was starting to give me like major back pain. Like I could start feeling the throbbing in my abdomen, but my back was hurting. And by the time that, is 4 treatments, so 8 weeks ended on that full theory, like I was spending most of the day in the bed, like knees up to my chest, just to try to get a little bit
Yeah.
of relief on my back, a heating pad. And I didn't go from there on until around Thanksgiving. I didn't go any time of the day without being on pain medicine.
Jeez. So yeah, and then they're talking about, oh, we can make this chronic disease, and you're
Yeah,
like,
no.
what's the point?
Yeah, by that time I was like, I don't want to be. This is a life worth living if I'm in this much pain constantly. As it got progressively worse over that summer into fall, and back at that time, since I was on Medicaid, Medicare, I had to go through all FDA approved treatments before I
Mm.
could be qualified for a clinical trial. So the worst part of it was that last treatment. I forget the names of the drugs I was on. We knew it was going to fail. The doctor said there is a like 0.001% does anything, but you got to get through it so you can
Mm.
qualify for the clinical trial that we have hopes for. So that 6 weeks was some of like the worst that I can't even put into words of just walking into a building knowing that you're going to feel. And it was the hardest treatment. Like it gave me skin rashes, like acne, along with all the other side effects. And just to keep myself trying to walk into those doors. And the cancer was growing so much during that 6 weeks, it grew around my stomach and intestines to where at the end, I couldn't eat. Anything I tried to eat would just sit in my stomach and throw up, which made me go to the emergency room where I spent a month and
Jeez.
started my clinical trial in, the hospital for that month.
Wow. Wow. And I mean, to your point of being told that we can treat this until it grows, and that's the paradigm here. That's the idea of when cancer becomes a chronic disease is you have treatment one, it goes for what, treatment two, treatment three. But when all of your treatments are failing immediately, I'm curious, like, how do you hold on to hope that a trial is going to do anything? Like, what did you grab onto to keep going?
At that point, I'd already set a goal. I was like, I'm going to make it or going to try my hardest, go through anything I had to make it to age 30. I
Mhm.
was had just turned 28 about a month before I got put in the hospital for that long. I knew I was going to at least get a shot at the trial. And I was like, I'm going to try my hardest because I had zero hope that the trial was going to work. I mean, after so many failed things, by that time going in for scans, I just expected bad news. And so I was like, I'm going to do everything I can, not even really for myself, but for my friends and my family, to try to get a few little, life milestones in. And then once I was like in my head, once I hit 30, I was going to be done with everything and just, you know, be okay with whatever happens. But that was the only thing that kept me showing up to another treatment, knowing it might not work, or then saying yes and signing the hundreds of pages of,
Yeah.
signatures and stuff for a clinical trial.
Well, you were saying that your family, your friends, these were the things that motivated you to keep going when you didn't expect progress. You didn't think these things were going to work. What do you think would have been their reaction if you had said, I don't want to do this anymore?
I think there would have been a lot of them, probably a good percentage of them that would have understood because they seen what I was going through. I was laying in bed on a heating pad. I was, I would try to eat something and I have to run outside and throw up constantly. They see me keep losing weight and not even be able to like sit up and watch a football game that, watching sports have been my whole life and like had so much fun with family and friends. I had no interest in even cutting the TV on most of the days. So I think a lot of them would have been like, you've tried your hardest. We're okay with whatever. But I think some of them, even subconsciously, would have thought that I gave up.
Yeah, and I mean, it's so hard when someone is so young, or even for people who are older too. The feeling of not exhausting every possible option is really,
Hmm.
really hard for some people
Yeah. And
to
I think
grasp.
I get that because looking back at myself when I was younger, I was like, seeing something on a movie where somebody would make that choice or a TV show
Mhm.
where they'd be like, "Oh, I'm not going to do that." I'd be like, "No, that's weak. You're doing this." But then when you're actually in those shoes and you're like, "Okay, well,
Yeah.
you know, 24 hours is a long time when you're in constant pain and you can't do this or
Yeah.
do anything but lay on the bed and you know it's not getting better."
Well, and then that was your life. That's what living with this as a chronic disease meant for you at the time,
Yeah.
and that changed at one point. So yeah, tell me a little bit about that. So you're still here, so there's some good news.
Yeah, I mean, it took a while for me to realize it was changing because, as I said, I got put in the hospital when the cancer grew around my stomach. I went 450 days living on TPN, which is total, nutrient, getting a 13-hour infusion every night. So I was still in bed about 23 hours a day because I had GJ tubes. I just had bags everywhere, like a pain pump. It was just,
For people who don't know, I mean, that is really, really significant. I'm not sure I've encountered another patient with cancer who's been on total parenteral nutrition, IV nutrition, for anything close to that long. I mean, having that for that long, I mean, it's a risk for fungal infections. People get really weak. It doesn't have everything that you would be eating.
yeah,
And the tubes that go through the stomach to drain things. I mean, I want people who are hearing to have a full appreciation of just how dramatic that is and how deep down you were
yeah.
in probably,
Because there's a few people I know that have been on it, but they were still able to eat to get other nutrients.
yeah,
Anything I put in my stomach, it had to be able to go into the GJ tube where I had to empty those bags.
yeah.
And like all the, stomach acid and stuff in the intestines or anything I even drank just to wet my mouth would go into the bags. So I didn't want to go out in public because little kids would see stomach bile's green, or if you have a
Yeah.
Coke, then it's brown and green, and they just look at you. And I'm just like, I mean, I get it. At that age, I would have stood there, stared at somebody like that too. So, but,
Well, and I mean, to your point, if this is what chronic means and you
yeah,
can't
it
eat, you
was,
can't, yeah, I mean,
and I think it was hard, very hard physically, just my body weak and just, I'd never slept good at night because you would always hear that pump going. So I would sleep from like 6 a.m. to like 1 p.m. And then I would try to get up and, walk around the like, little basement apartment I was in. But at 2:30, I had to start getting ready to get hooked back up. So it was like that was my whole day. But mentally, just that's when I really realized, like, yes, food is nutrition. It keeps our body going. But there is such a mental aspect to eating or being able to sit down with people and enjoy stuff over a meal and like just missing that completely. Like two Thanksgivings, two Christmases, like holidays, birthdays, just you smell the food, but you can't eat it.
yeah, I
And you
mean,
just sit there and watch people and like just mentally it would like every day, like around dinner time or something, it would just put me in like a spiral. And this was all at the time where I started the clinical trial. And I was getting the scan results after about 3 months of the clinical trial. And it took a while to start working, as you know, immunotherapy kind of does. But it was the first time I wasn't getting horrible news on scan results.
hmm.
But my life was so hard. I was like, I don't feel like I'm improving none right now.
Yeah, and what you're mentioning is not super common. People
Yeah.
experience this kind of thing where the symptoms were so bad that even though the therapy's working, you're still feeling terrible. Most people feel better when the tumor responds, and that's what we expect. And a lot of people can come in and actually tell me ahead of time if they think the treatment's working, and then you look at the scan and you're usually right. But when your quality of life starts that low, and I mean, you were on this stuff for over a year.
Yeah. It
Like
was
the therapy worked
14 months. Like,
pretty well by that point, so that it had
yeah.
done a lot of damage to your body that needed to be fixed later. So, yeah, tell me, a little bit about having that contrast. Like you had the scans that are positive, there's some reason for hope, but your quality of life is really struggling. So you're still kind of in that pit of despair. How do you reconcile those things?
Yeah. Well, the lucky, I mean, I say it's lucky now, as this is was my lowest point kind of early in that 14 months. So that's when I started getting therapy and getting help. But the scan results were coming in, and my family, they were ecstatic. They were so happy. They would just, you could see like them enjoying to come and be around me more, which, I wasn't in pain and just rolling over and trying to sleep while they were there. So I was actually awake and able to talk. So in my head, I knew I was getting better with the cancer, but I was still like, I'm laying in bed. I'm 28. I turned 29 during this time. I get on my phone or social media. Everybody in my life is,
Yeah.
working, getting married, out on dates, having kids, enjoying this life. And I'm laying here watching reruns of The Big Bang Theory every night, which great show, but
Yeah.
it gets old.
Well, and you were an athlete before
Yeah.
this.
And that was one of the harder parts too, because it's just knowing like what your body can do and how like I push my body and like the things that I used to could do that were, you know, not uncommon in the, world, but I was better at a lot of things athletically than people that I grew up around and in my area. And now, it takes me 10 minutes to get out of this hospital bed, carry these bags, go to the bathroom, not even mention because I'm not using my stomach or intestines. Every Sunday, I had to do a suppository just to empty out my
Yeah.
body, which I'm like, just mentally, I would start dreading that around Friday because it was horrible. The cumulative of all of that, it was such a vast difference. Like, I was happy that I was doing better. I was like, okay, is there ever going to be a way that I can get rid of what I'm living with right now and enjoy this, treatment that's actually, controlling my cancer for once? But on the other side, in the depths of it, I was like, I don't know how long I want to do this TPN or live like this because I can't spend 23 hours a day in bed.
Yeah, and when we talk about living with cancer as a chronic disease, we don't usually frame it such that the chronic disease state that you're going to be in is different than what you're used to. Because it's hard to, you can't anticipate what it's going to look like. So when you were on TPN and we were going through this, did you have a sense that like this is just what it is now forever? Or did you have a feeling that things may one day get better?
I did not have the feeling it would get better until about the fall of that year. That was the first time that we did a scan. So I'd been on the clinical trial from right before Thanksgiving, and it was right before my birthday, so September. So I'd been on there for a good section. Every scan had got better, and my doctor was like, "Hey, if this scan comes out good, like we think it's going to," he was going to like suggest I go to see this specialized surgeon in Asheville that he specializes in abdominal cancer surgery, and to see if he thinks there's any way that they can do something to where I could eat again. And that was the first hope I'd had. Now, I mean, that was September, so it didn't really happen until February, but it was the first time I'd had hope. And they wanted to go through another couple scans and more treatment to see, as long as like the cancer was shrinking, they didn't want me to even stop a treatment or like
Mhm.
extend it where you'd have to with that major of a surgery.
Yeah.
So toward around like October into December, they did another scan, and it was like a very minor like shrinkage of like the tumors that were in my body. And that's when we really started ramping it up to where I actually had hope, probably for the first time, that maybe I might have something of a life again.
Wow. And I mean, kudos to them because I can say for cancers that don't historically respond super well to therapies, to do these aggressive surgeries, knowing you have to stop things that might be working and there's risk there, that's a hard decision to make for a care team because you're doing better. They don't want to compromise that.
Yeah.
Um,
And I mean, they didn't want to compromise it too, because I mean, this was looking back on it now to know the drug that I was on, this was a major, worldwide, like huge trial that is now, saved a bunch of people's lives and a bunch of different cancers. So
yeah.
I'm like, well, the sponsor, them, they're like, hey, we don't want you to change anything. He's responding really good right now, and this is going to be great. But at that time, I didn't. Me now, I know that because I'm in the clinical trial space and do a lot of advocacy. But back then,
Yeah.
I'm like, no, I want a bit better. Now I want to be able to wake up and eat breakfast.
Yeah. So you had the surgeries or, and then you were able to eat again.
Yeah, it was. I was expecting an immediate, like, just kind of aha moment of like getting to taste food again. Didn't realize that if you go 14 months or 450 days without eating any food, the first 3, 4 weeks, all you're going to taste is salt.
Oh, really?
Yeah, I did not realize how much salt is in all of our food until that point.
That is not what I would have thought.
Yeah, neither. Like I was like, I went, and you have to slowly because it was a major abdominal surgery
Yeah.
again. So, they take it slowly. First, you get that broth, which is always salty in the hospital, the chicken or beef. So I'm like, okay, that's okay. That first time they gave me some oatmeal and I like almost spit it out because I was like, hey, did y'all give me salt instead of sugar? And they're like, no, sorry. I was just like, okay, this is weird.
That is really weird.
Yeah. But over a few weeks, it got better and better. And then like I remember it was I want to I forget what day. I know I was out with some friends or not like in my basement thing and we watched a basketball game. And that next morning my aunt brought had a Krispy Kreme donut and it was the first time something had tasted like it tasted different than it used to because I think like your taste buds just change if you don't eat so much or over
Yeah.
that time, but it tasted good. And I was just like, oh wow, that might be the best thing I've ever had in my life.
You have a commercial for Krispy Kreme waiting in here somewhere.
Yeah,
Yeah.
I mean it was just like okay, I'm better now.
Well, no, I mean that's interesting. The taste buds definitely will change, but the sense that you would be that sensitive to salt that you're gonna taste oatmeal and it be overwhelmingly salty,
And I
is
mean
pretty
that was
shocking.
yeah, that was 2017, and I'm still a person who I don't add salt to anything of my
Yeah.
food. Like used to growing up where I did, you would always salt,
Yeah.
pepper everything. I haven't used the salt like shaker since.
Probably probably for the best. Okay, so you're able to eat again, and this was roughly how many years ago at this point?
This was around February of 2018.
Okay.
So still not even 2 years into my whole like diagnosis, but all this happened within that first about 18 months.
Was this a turning point where you're like, okay, I can do this now?
Yeah, once I recovered, I started eating again. I mean, unfortunately, with me, I just have some bad luck. At some point when I wasn't eating, my gallbladder just
Uh,
expanded and never went back. So I started having really bad pains again about 6 weeks after I got out of the hospital. And luckily this time it was only a weekend in the hospital and they're like, all right, we got to let you heal from this major surgery. So we're going to put a drain into your gallbladder. And in about 3 months we'll come and we'll take it out. So
What,
I was like, I almost went like 2 weeks with no drainages coming out. And then I had one in for 3 more months.
how deflating was that?
It was at first like I remember like my mom and them leaving the hospital because at that point I didn't need anybody staying the night with me. I was like, I'm getting close to 100 days in the hospital. I got this.
Yeah.
And when they told me that, then I remember breaking down in there and just like, am I ever going to not have a plastic drain coming out of my body?
Yeah.
But when they put it in and then they showed me how the little bag was and like the thing where I could like stick it in my pocket and I wasn't carrying it around, I got a lot better.
It was one of those bulbs.
Well, I mean, it was like at one point it was a bulb, and then when they had to replace it, it was just like a little package kind of
Yeah.
thing that you there, and then at the bottom you could just like drain it out, and
So it's very different from your
yeah,
gastric
very very
emptying
different.
tube.
Yeah,
Yeah.
I just had to, by this time I was really used to sleeping on my back because I didn't want any of the drains to move or the stitches holding them in. So I was just like, well, 3 more months of sleeping on my back because my whole life I'd always slept on my side or something. And it was so hard to get
Same.
used to just sleep on your back and not moving.
Yeah.
I think that was just like, I was like, sometimes you just want to like roll over, but
Well, and it's interesting because you're talking about, or we're trying to have this framing of, okay, it is a chronic disease. And when I think of that, usually I'm thinking about a stable life at a certain quality of life. Like that's what I think of when I think of something as a chronic disease. But what you're pointing out is when cancer is a chronic disease, there's a lot of blips. There's a lot of downsides, and it's not a stable thing and a stable quality of life for everybody. Some people do get that, but it's
Yeah.
not everyone.
And I mean, like, I think my life today is a lot more stable than it was there. So this is, I think, like the life I live today is going, I go treatment every 3 weeks. I have some issues and some, rough times when, a spot might pop up or I have to go get a procedure. Earlier this year, I had to get a liver biopsy. And
Hmm.
so always are going to be those things, but it isn't how it was. And at that point, I never thought I would get to this, like, kind of chronic illness is my life. I thought it was always just going to be one thing after another, like some major issue, major procedure, going in for surgery, staying a couple nights in the hospital here and there.
And when you were first, back in, I suppose, 2017, or 2018, when all this was happening around that time, did you have a sense for how long the immunotherapy might last? Was that on your mind, or was it just, we'll see what the next scan shows and we'll take it from there?
Yeah, it was on my mind a lot there because I mean they tell you up front the clinical trial they're like, hey, it's doing good right now, but it might stop working or it might start attacking your body because the immunotherapy can attack the organs in there. So I think even maybe till 2020, 2021, when I started really getting involved in advocacy, I was always worried about that. Every scan, I was scared to death in there. And I was actually talking to somebody when I was on some of my travels earlier this month because very different story, but we're both on the trial, both CRC people in the trial worked. He's like, his doctor was like, yeah, you're kind of writing the roadmap of what everybody else on this treatment will go. Like, we don't really know what to do. So it's kind of, not making it up as we go along, but, you know, they're listening to us as much as I'm listening to my oncologist about how the treatment's impacting my body, how I'm dealing with it, the blood work, how everything's working out, because there's nothing to go back on for this drug that I'm on to be like, oh, yep, you hit this point, you can stop it,
Yeah.
or we can do this. So once I never thought about it that way until a month ago, but I was like, that hearing that would have made a lot of the issues I went through earlier make a lot more sense, I guess.
Hearing what specifically?
Like just that there's nobody or no information really to go back on like other treatments that are,
Hmm.
FDA approved. They have decades worth of people that, have been through it all. And almost every situation that can happen has happened in somebody before.
Yeah.
They're like, you're the first one right here.
Yeah. And, for those who don't know, your tumor has a mutation that makes it really responsive to the immunotherapy, which is one of the really big breakthroughs in science. And this immunotherapy uh, the investigators got a Nobel Prize for this, so it was a big deal. And it's not like they knew it was going to work this well when they started the trial. Like they thought it'd work, and in other
Yeah.
diseases it worked. It didn't work this well.
Yeah. Knowing that now, like at the time, I didn't know all, like, I wasn't in this, research advocacy space. So I didn't know all of this. I was just like, oh, yeah, it's another drug going out there. But knowing that now, I'm just like, very lucky. There had to be a lot of things that happened at the right time for me to get on this drug and get this and to be able to take a, cancer that was very close to killing me to make it into the chronic illness or it is now in my life.
Yeah, and even though you've had that excellent response and you're still on immunotherapy,
Hmm.
yeah. So even though it's
Yes.
still working, it's not gone.
Yeah.
So tell me a little
Yeah.
more about like what is the ongoing challenge? I think there's a misconception that they see the diseases in cancer that respond really well and have really good outcomes, meaning people live longer. And they're even this is common from the provider perspective, where a provider will say, "Oh, you're really lucky you have XYZ," and it's like, well, it's not. I wouldn't really call it lucky. Maybe slightly less unlikely, but
Yeah.
you still have to do all this stuff, and every scan is still scary. So how do you navigate the ongoing? demands of living with cancer as a chronic illness.
Yeah, it's very hard. And I know I'm still struggling to deal with like society and people that see me in my life and like their perception of me now. Cause everybody knows I'm, still a cancer patient. I'm still going treatment, but they're like, oh, you don't look like what cancer does on TV or in the
Yeah.
movies or this. And I'm like, yeah, but it's still there. I was like, I can show you my scans. And
Yeah.
I think that's been the biggest hurdle here lately is just having people tell me that like, oh, you look great and you do this. And I appreciate that. But I'm like, you still don't see me 5 days out of every 3 weeks where I'm
Mm.
not getting off the couch. I'm, throwing up or then some days it's just, I feel horrible. I'm sick and I deal with it kind of like I've found that purpose in my life, but it's just, I want to say over the years, I've just learned to like push through, not in the sense of like, I'm going to push through and ignore my body. Just, I went through so much and I missed so many days.
Mhm.
If I felt bad and didn't get out of my house every day that I felt bad, I would never leave.
Right.
Like, I never feel great. It's just, our bodies are crazy what we can adapt to. And I think once that kind of set in and I just was like, oh, yes, I feel sick today, but I'm still going to get out. I'm still going to go do this. And it didn't, not saying it didn't make me feel worse, but it didn't like put me in the hospital or make me crash out again. I was like, okay, well, I did it once, so I can do it again. And it was all about quality of life. Like my quality of life got a little bit better, like outwardly.
Well, and you raise an interesting point that I've heard from other patients too through the podcast, where when you start to get in this chronic stage where things are a little more level, you're not
Ooh,
getting admitted all the time, you're not, you know, uh, at least visibly sick,
yeah,
losing your hair, things like that. People, the sentiment I've heard from other patients is people, I wouldn't say get annoyed, but it's very, very different from in the beginning when you did need the extra help. And then people are like, okay, well, you look fine now, like kind of
yeah,
get over it. It's like the sense I've heard because they can't see all the stuff that is just, it's been on your shoulders for a long time. And so maybe you can, this is my long-winded way of saying, can you describe the difference between the outward sentiment, the sentiment that other people had toward you when you were first diagnosed versus when this became a chronic disease?
yeah. When I was first diagnosed, it was like anything that I needed, people were like jumping over each other to help me out. Like, if I need somebody to take me to an appointment or come to, if I was in the hospital or come sit there, I would have 5 or 6 people just show up or want to do it. And just the outward help was like over almost to a point where it was overwhelming, where it felt like I never had to do anything myself because people wanted to help that much because they could see how sick I was.
Yeah.
And looking back, it might even be like when you're really sick, I think a lot of people want to help because they don't know how much longer they are going to be able to help you. And
Yeah.
I was very close to that quite a few times. And then over the years, some of it is my own fault because I got my own independence back and I was like, no, I can do this myself. But then they just see me and trying to live my life. So I think they assume that I'm feeling better or doing this. And I know they can't understand. I try to put in words to them. I'm like, when I get an infusion, my body, like how the immunotherapy works, is my body thinks I'm very, very sick. So you know how your body feels after you're recovering from a flu?
Mm.
I'm like, that's how tired my body feels every single day of my life. And it kind of gives them a little glimpse into it. But I just think so much what society does, good or bad today, they see me get to travel and they're like, oh, he's
Yeah.
good. He's doing good. They can't see the invisible illnesses. They don't see the mouth sores that, you know, coat my throat going down there.
Mhm.
When it's really bad, they'll notice I have a little bit of a lisp or I change the way I talk because it hurts so bad. You can't see bone pain or joint pain, neuropathy. So,
Well, and a lot of those things, it's not necessarily empowering or
mm,
helpful to be outwardly displaying everything that's bothering you all the time.
yeah,
So I can imagine the people that you're around or your network, they're seeing on one hand your social media platform, which you have a large social media platform. And I think the reason it's done so well is because you're very vocal about this ongoing, I'll call hidden curriculum of being a cancer patient where you still feel these things. But then, so they see that, and then they see you going to the store or you're on a flight,
Yeah.
and, and it's like, is he faking it? Like I could
Oh yeah.
see people thinking, is he embellishing? And how do you reconcile that challenge?
I think I'm lucky because I know people that are in my community, my family, my friends. Since I live in such a small area, I know they know I'm not faking it
Yeah,
because
yeah.
they still see me on treatments or they see me leaving and going to a infusion or they've seen everything I've been through and they just know that. But I have had people on the outside look or that find my social media and they're like, "How can you be sick? Are you sure you're really the biggest one is like, how aren't you dead yet? If you've had this for a decade." And I'm like, I don't know how I'm not. Yeah,
I'm sorry.
I'm very lucky. Yeah, I was like,
Yeah,
I know a lot of people that have died that I wish were
yeah.
still here. That I'm, you know, and I think I just reconcile that because I know how I present like my life through social media and my platform. There's a select few people that are ever going to walk in like, I mean, I hate to say select few, but unfortunately there will be that walk in the, this path that I've walked in. And if I can share my lived experience to help them not go through so many of,
Mm.
the spirals and the downtimes that I did as I was navigating this, that's all that matters. And it took me a long time to realize that. And still to this day, there's some days where, yeah, that's stuff that when I hear people or I know people are thinking that will hurt me. But overall, it's just that thought of like me not sharing outweighs that so much.
Yeah, and I think the feeling of knowing those dark emotions that we get are not
Mhm.
unique to you when you're feeling it and you see someone else who's gone through it. And well, particularly you who's I mean, the TPN story, I want to reiterate just how challenge like that's really, really tough. I mean, that's at the edge of what I've seen people come back from. So to be able to have walked that, come back, and be a voice for other people who are going through that, hopefully does show that you're allowed to feel those really, really negative emotions, and people make it through. But to that other point, as you were saying, there are people that this doesn't get to be a chronic illness for.
I think also that's why I keep doing everything that I am doing and I want to do just because that mixture of the patient, the lived experience, and the researchers and pharma, and just it's all got to work together. And if we can, cut down those people that aren't here and that, make it, who knows what the next generation, if we can make it a little better for them as a whole, I mean, that's kind of the purpose of life, in my opinion, to, live this and leave it a little bit better in like our circle than we've had it.
Has most of the input you've gotten from social media been positive?
Most of the time. Like, I mean, social media today is so divisive. And, you know, I try to keep a lot of the divisiveness out of it because the way I've done social media, I don't really go back and answer comments because what I put out there, I want you to digest it how you do. And if I'm answering questions and comments on there, I think it might sway you a little bit because I know as I read comments, I'm like, oh, well, now I'm thinking about that, what they said a little different. And I don't want that to happen. So I know if I make something like divisive, it could just go off the rails there. So that's, a negative of it, but it's mostly been very good. And I mean, I will always love social media because of all the positives it brought to my life. It brought me into advocacy. It's introduced, my very best friend in the world to me from across the country.
Yeah.
So like just that, and I wouldn't be the person I am today without of sharing my story on social media.
What would you say, how has social media helped you with coping with having cancer as a chronic disease?
It's made me realize that there's other people out there. I'm not alone. I wasn't the only one that's living this, but also it showed me that you still can be going through all the issues of living with cancer as a chronic illness and still go out there and try to enjoy life. And it's not going to look the way that you dreamed of it was as being a child. But when you take a step back, nobody's living the life they dream. Everything they dreamed about as they were, at 4 or 5 as a teenager. I'm not a professional athlete, so that kind of ended that one quick. But it just showed me that there is a life out there, and I don't know if I would have had that if I wouldn't have started. If I'd have stayed in my own little cocoon or my own little bubble.
Yeah, a little aside, what athlete, like what was your major sport?
My first love was basketball, but then I fell in love with football and I played, Division II college football. But once I started getting up to the upper levels of that, I realized like, yep, there's a lot of levels to this athletic stuff. And I like tap out right here.
Yeah. What was your position?
Linebacker.
Yeah. Yeah, those are big guys.
Yeah. Yeah.
Um, yeah, and I think it's interesting. What would you say is the biggest, I'll say, dream that was altered? You've done outstanding work with this new hand you've been dealt, but what was the biggest deviation from what you wanted to what actually happened from cancer?
I think so far in my life is just I always imagine myself with a family, like a family of my own, and I never thought I would be 38, single, no kids, not having a career like a traditional career. I'm still working on, and there's so many people in my life that are working to convince me that yes, my advocacy and everything that I'm doing is my job now. Like I'm still trying to get over that hurdle in my own mind, but I think just the traditional of aspect that I thought where I would be at 38 even, the year before I got sick, I got promoted in the job I was in. I was getting in shape, kind of getting my life in order to get back out there and, be like, okay, I had fun in my 20s. Now I'm getting, serious about this. So I think just like the loss of those opportunities.
What elements of the cancer diagnosis and treatment still hinder those things today?
A lot of it's just how the treatment and just my life with cancer is like affected me mentally. I know a lot of it's on my shoulders and there's a lot of things that I gotta, hurdles I gotta get through. So many aspects of my life is wrapped up into cancer and I wouldn't have it any other way with my advocacy and everything. So I just gotta internally get through the mental, blocks that I have of me getting back out there and dating again. Cause as of me, like I see myself as like cancer front center billboard. And I'm like, if I see that, everybody else is going to see that. So why would they ever worry about dating somebody or, you know, starting something like that? So it's a lot of internal stuff that I got to work on. And I think that's one of the biggest parts of living like with cancer as a chronic illness is there's so many internal battles that you have to go through because survivorship into people who, get NED or no evidence of disease or cured or get away from it. That's just a whole separate issues that I respect, but they're different when you're continually going to treatment, continually getting scans and never going to be like, yep, that was just that part of my life of active treatment.
Well, I think increasingly this is going to be what it looks like to have cancer as a chronic disease is people are going to continue to have treatments, people are going to continue to have scans or some form of disease monitoring. And I think this is going to be the case more and more for people with earlier stage disease too. Some form of ongoing monitoring where this isn't just going to go away
Yeah.
because we've seen how that plays out. I mean, you were an
And
example. You were a
yeah.
localized disease that spread.
And also, I always want to iterate too that that is like the goal for me, like right now, to make all cancers to be able to go that are incurable or they can't be, cut out or cured to be a chronic illness.
Mhm.
Because that's like everybody wants to hear the word cured, but I'm like, if you can get anybody that was like diagnosed with that at 20, 25, 30 years of, quality of life there, that's like a game changer in my mind. The more I've got knowledgeable about everything involving cancer and the disease.
Well, and piggybacking on what you were saying earlier, where having that diagnosis alters your perception of self-worth, and we've talked about this before, and you're not the only one that's mentioned this. This is a common sentiment that someone who has ongoing surveillance for cancer is on treatment. struggles with the feeling of like, well, if anyone can choose anyone, why would they want to take on this burden? Because it's a lot of your life that you're doing this. Um, but continuing that thought, you're someone who's championing how we interpret this and offering a roadmap for other people. Because I think this is going to get more common that people have the long term responses like you have, and where you see which is which is just so common. You see this thing that's this deficiency, so to speak. Whereas when at least I look at it from the outside looking in, I see someone who's overcome so much adversity. I see capability, and I think that's going to be the challenge where when people have this as a chronic disease, you feel this risk, but other people looking out from the outside looking in see uh, having overcome tremendous adversity, and that's someone who's really capable.
Yeah. And that can go back to the points we've made in previous episodes about how we have got to start addressing the mental health and the therapists
Yeah.
and aspect of it from the very beginning instead of when you're already in the depths of it.
Do you think that would have changed how you viewed your life with how you viewed your self identity, I guess, as this went on?
I don't know if it would have changed it fully per se, but I think I would have been better at depth at handling the major issues that put up so many roadblocks in my head. Like, I think there's always in the core going to be that, base feeling of like, oh man, am I worth that or there? But there wouldn't be so many roadblocks of things I've been through in the past and, cause weeks and months of, depression and issues
Mhm.
that I'd have to work through to get to that kind of base level.
Yeah. So, what would you say is the hardest part for you now that you're at a pretty stable part? You've been on this therapy for a while. What continues to be the biggest challenge?
I would say there's two. Always just the, you know, the side effects from the treatment. Just, I've been on treatment 10 years. There's side effects that used to go away after 7 days or after a week or 2 weeks. They're just constant now. Like I've had mouth sores or, like a very raw mouth, bone pain neuropathy for years that never go away. And I think just the constant battle of that mentally, like sometimes in the middle of the night, my skin issues will be so bad that I can't sleep. I can't have any covers on me or anything just because my skin itches and it's just so painful. And I mean, that's not all the time, but it is like, especially in the wintertime, because the treatment, it dries my skin out, add on dry weather and cold. And so I think that is one of the big, like physical things of just dealing with that. And it's not going to stop. And then mentally is just, life with cancer is tough, but survivor's guilt. The more I've got into advocacy and the longer you're there, unless you just totally isolate yourself from everybody. But even then, you're still going to know people that even if you don't talk to, you see in your cancer center that undoubtedly will pass away or that,
Yeah.
they're still supposed to be there coming to treatment, but they don't. And I think
Yeah.
just like dealing with that of why is it working so well for me? How have I got this extra 9, 10+ years and it didn't for them? Even like scientifically, you could be like, well, they didn't have this, mutation that didn't work. And yeah, it makes sense there. But mentally, you're just like, well, no, it should work.
Yeah, and that was just chance that
Yeah.
it happened.
I mean, yeah, like you're like, why did I, get lucky? And this
Yeah.
guy right here who is an amazing person that I love to talk to, love to hang out with, had, wife, kids, all that didn't work for him.
Yeah. Well, and along those lines, what would you tell someone who's newly diagnosed with cancer that has promising treatments and they're looking at living with a chronic disease?
I would say, you can look at the last 10 years and everything that I've went through, and we're at such a better place in just those 10 years. And there's, the future is so bright. It might not always look like that from, hearing it from the outside in about cancer research and all the treatment options, but it is so much brighter than I ever thought it could be. And there's just options out there. And, I would say just don't give up hope and go for it. And, but always be true to yourself and never give up that quality of life that you're going to regret for something.
No, I think that the wise words, from someone who's been through all of it. And you've ended up finding a lot of meaning, and you've done tremendously good work in the advocacy space. I think that's how I met you. That's how a lot of people know you, and you're well known in the provider community. Like doctors know you. So I'm curious, how has having cancer as a chronic illness, meaning you still have it, affected your advocacy work over folks who have been cured and are advocates? Do you think there's a difference there?
I think the only difference I really think of is like what I was talking about a little earlier is like the survivorship aspect, because that is a huge part of advocacy. Because so many of my friends, they deal with so many issues when they are NED or when they're, past that active treatment of, yes, we were talking about like people look at me different, even though I'm still on active treatment. People think you're just supposed to be better once you end treatment for them. And so they have to deal with that aspect, and I have to deal with the ongoing aspect of what we've talked about, the never ending treatments and the issues there. And I think that's the biggest difference, because I can't speak to that point in advocacy. So anytime there's questions or there's somebody, wanting to give a speech or want me to talk about that, I'm like, no, you need somebody over there that's been through that. I've never even thought about those questions because that's not my life right now. But overall, advocacy has been such a blessing to me. As you said, I've met incredible people, had chances and opportunities I'd never dreamed of. And it's made me a better person overall, and kind of unlocked a lot of things that I probably would have never knew about myself there if I wouldn't have started doing advocacy work.
And it's funny because in this field of cancer treatment and things, there are a lot of ways to become an expert in something. And I think you've identified a good path where you can be an expert at the patient experience, so to speak, because it's not just being able to articulate what you're feeling well, but how can you put it out there and use those emotions and that pain and that experience to help other people's quality of life? And that I think is the difference. I think there are people um, who work in the advocacy space and people who work in the provider space, and we're not using our experiences and talents super effectively or as effectively as we could be. And I think you've done a particularly good job of finding through the social media space how can you actually make a positive difference, and that's not easy to do.
Yeah. I mean, that was my only goal when I started this, is to be 100% truthful about everything and use my lived experience. Because I do a lot of stuff in like the research and scientific space now, which
Okay.
blows my mind because I hated that part of like school and everything growing up. So my main goal was just to be like, yes, I'm going to use my lived experience to try to help people. And I tell people all the time, I'm like, advocacy is what you make it. There's ideas of what advocacy is, but it's like whatever you feel comfortable with, and you're going to help somebody if you are true to yourself and honest and open about, your lived experience or why you're doing this or why this is needed. It's going to help somebody. And not everybody's cut out for advocacy, and that's okay. But if you are, it can be such a blessing to help you in this, life with cancer.
Well, I can't think of a more optimistic way to end the episode. Any last sentiments before we cut folks loose?
No, just appreciate the opportunity to talk about this, because it is something that I've felt is not talked about enough into our like little section of the cancer world.
Yeah, and hopefully, for folks listening, this is helpful. And JJ, we're definitely going to have more conversations about how you make the most of the terrible situation that is a cancer diagnosis, and how you leverage that for other people's positive, life experience. And you're the guy,
Yeah.
you've been doing it.
Well, I appreciate it and look forward to the conversation.
All right. Well, thanks, JJ, and everyone. Thanks for listening. Again, this has been Cracking Cancer. If you like this episode, feel free to like and subscribe, and you can visit crackingcancer.org for more information. All right. Bye, everyone. Thank you for joining us on this episode of Cracking Cancer. If you found this helpful, please like, subscribe, leave us a review, and visit crackingcancer.org for more information. Every dollar we earn goes directly to furthering the podcast and supporting vital cancer research. Because together, we can crack cancer.